Hi guys, how are you? How was your day? And now we are 1, 3, 4 students on my cell phone. Well, you tell me if you want, we can start now, or maybe we can wait a little bit. There is no problem for me. Let me prepare this. Hi, good night, everybody. Please let me know. Can you watch my slide, my screen?
Yes, Doc.
Okay, perfect. So I think we are enough at this moment. So let's start. Well, as I was telling you, This week we have 2 theoretical classes, and these classes are going to be as an introduction of module 2. So in that way, let's review, let's check some vocabulary and general definitions and abbreviations related to the medical career, I mean. Well, all of this information is general, as I was telling you, it's important in order to get the correct way of expression while talking with my colleagues or maybe start for finishing on time. Well, today we are going to talk about medical practitioners 1 and 2, nurses that are very important to us, and allied medical professionals. It's important to consider the professions too, because they help us for working a lot. Sometimes we are, or maybe the way we combine our activities, but in order we can working with us, it's not possible. I'm sorry, let me share again. So as I was telling you, considering these details, let's go ahead, okay? We have lots of definitions that we must consider. When we talk about medical practitioners, when we talk about the doctors, we don't have to get confused on the situation we are placed at the moment. We have to take in account that this profession must be qualified. If there's not enough qualification, we don't have the capabilities to do this job, or maybe we don't have the complete loyal practice in order to get it. So that's why we have to take it in account, okay? That's why we have to get an university degree in medicine, and we have to be registered in order to practice. Taking all of these points, then we can work on this career, I mean. We have to consider that a clinician is the doctor that makes research and treats patients. So it's important, this word research, because we have to take it in account in order to get all of our medical activities organized, well done, and getting a point of view in order to talk about and practice. So in that way, we must check that it's important to consider this. Moreover, a general practitioner, the abbreviation GP that we are talking during the module 1, is the doctor that provides primary care. For example, I'm a general practitioner. At this moment, I don't have a specialty. So in that way, I'm prepared to start working in primary care, and then making degrees. I can research, I can work on better places, on different places, I mean. In that order, GPs, general practitioners, work in a group practice. We don't work alone. Examples like this, we have lots. I mean, there are many places where we can see this organization, this way of working. General practitioners start the medical activity, then they refer patients to specialties in order the situation, not because it's free. That's why it's important to take it in account, okay? About the specialties, as a general view, we consider that, well, they generally work in hospitals because they have more capabilities done in a specific point of view, in a specific system. So it's not a good idea to take them in the general and the primary care, because they have another way of thinking in order to find solutions that are specialized. I don't know. I know if you get the meaning of this sentence, but that's interesting how the job is divided. Okay. Now we consider the private healthcare may have consulting rooms outside the hospital. It's the way it's private. It has a cost, and we have to reach this service by paying. Primary care usually supported by governments, but we are going to check it in the healthcare systems. I mean, that kind of organization that governments give to us in order for working. Moreover, as a general idea, we have the two principal branches in medicine: surgery and internal medicine. Surgery, of course, surgeons; internal medicine, physicians. Physicians are, well, the ones that don't go into the surgery room, the surgery theater. So it's not a difficult idea to take in count the meaning in English and while talking with colleagues. We have these suffixes, the names of a specialist, usually end in ology. For example, oncology, ologist, oncologist, the one that is working in that branch. The name of a specialty ends in ICS, for example, obstetrics. The name of the specialist ends in ICIAN or ION, physician, surgeon, for example. Just as an example, to consider this in order to make the translation, or maybe while talking to colleagues from another countries. And well, just to take it in count. When we try to consider a specialty, when we choose one, of course, we need to the medical school. We have lots of options, lots of ideas. We get one branch and it's interesting at the moment of practicing with our friends. I mean, and we have so much time to consider that it's a new word, maybe. That's why we have to think about it. Well, we have to think on this situation, could be on our capabilities, or what I like or I didn't like to do, or the way I develop with my countries, with my depending on the situation of my country, because there are many countries that give the specialties, the spaces for studying according to the necessities at the moment. One example of this is Cuba. They take in account how many, for example, how many surgeons have working because they are young and strong. They can do this job without any trouble. And then, depending on the one that are going to be retired that year, they decide how many new doctors are going to get into the specialty branch for studying. It's not free. Not all of them get the opportunity of taking the specialty they would like to do. Here in Bolivia, of course, it's different. We have another way of working. This diagram is kind of joke that show us how I would choose a specialty. It says, I don't know what medical specialty to choose. So following the questions, following the lines, we can check what kind of job I like to do, what kind of activities I like to develop, if I like to love with people or not, or maybe how good I was at the medical school. or how I like to get in touch with some people. It's just a joke for considering this, but it's showing us in the important way, it's showing us how we can consider in which branch we could be better, or we could make a better developing job. Because we all know medicine, it's not an easy fact. We all know that in medicine activities, if we don't feel comfortable, it could be harder for us to get our job well done. We need the practice. We need to get the place where I feel comfortable. From this point, medical practitioners 2, I decided to get the title, the principal title. I like to show you some definitions in order to take them in count and consider this while talking. So the staff is people who work at any type of workplace. It doesn't matter. For example, we have the hospital staff, all the people, administratives, doctors, nurses, the cleaning team, I don't know, everyone that is into the institution is a part of the staff. That's why we have to consider this important word. Moreover, we have the hotel staff, for example, everyone that works in the hospital. So I think that it's clear, and we all use, well, we use this word even in Spanish, and it's the same meaning, of course. About the medical staff, we have to consider the hierarchy into the medical career, into the medical preparation. It's not the same, our career, because we work as a team. We must learn to support each other while working, while living, while being in practice, and while having patients, while attending patients. Well, the medical assistance is always in group. We cannot do it alone. We have to be clear on this. If we not work as a group, it's not possible to do it. We have the fatal destiny of failing. That's why we must learn to do it. We need to understand this. Talking specifically about doctors, we take this: the attending doctor is a trained physician practicing in their specialty. The specialist that is the most prepared in the room could be the professor of the room, if we make the exchange to Bolivia, because it's an American hierarchy. The fellow, the physician pursuing post-residency training. In many countries, the fellows are that professionals that finish the residency time, and then they have a period of practice into the hospital. For example, in UK and USA, that's the way of working, of practicing. You finish your residency and you have around 6 months for working by yourself and taking in confidence with all of the situations without a teacher up to you, without the responsibility of the attending. You do it by your own. In that moment, you start being a fellow. When you are a fellow, you teach the resident. The resident is the physician pursuing 2 to 7 years of specialized training. That's why we are talking about residency. Is one of the most important activities into our career. In that order, we consider that it's not a kind of joke. We have lots of years to do it. We have to consider that depending on the branch we decide, on the specialty we decide, there could be 7 years more of studies, and there's a lot of time that we have to take in count for practicing, for being a student. When we finish when we have the residents on course, of course, previously we are interns. We are in the last year of the medical school. In that moment, when we get an intern, we have the opportunity to practice in many countries by your own, being supervised by the resident. The resident is supervised by the fellow, and the fellow has the support by the attending, and the attending is the responsible for everybody. And the medical student, of course, the one that is in the medical school, starting the practice, learning all the basic, very basic activities, and that's why we take in account that it's important. Taking in account this guideline to doctor hierarchy, we have lots of years, it's a life, a complete life studying, working, practicing, and learning, of course, and working in group. Without having this team, this complete team, sometimes we cannot get a real result with our patients. We cannot get the real ending, I mean. Here in Bolivia, it's similar. It's similar the way of working, similar the way of doing this. Well, this when we are studying, of course, this hierarchy, so take it in account. Moreover, we have for example, the USA hospital staff hierarchy, just as an example for making a comparison. And we check all of these situations, all of these places could be these steps. The dean of the hospital is considered as the CEO, the most important one. The director could be. The dean of the hospital usually is a team from many doctors, but one of that team of doctors is the head, could be of all of the activities, and takes the final decision in medical cases and administrative activities. Then becomes the hospital administrators. All the administrative activities are related to this branch. And we have now the specialists. Surgeons first. Well, when they say normal specialties, they refer to the clinical specialties, for example, internal medicine and that kind. Both of them are important, are almost equal, but surgeons have a plus. Why? Because of the activity they get, because the manual jobs they do. So they have that plus because America, USA give us the most important guidelines in trauma and surgical procedures and protocols, I mean, and that's why they have a plus on this, because of the kind of a study of research they do in this branch. Silent doctors are that ones that are here, the fellows, the ones that are not still with a full register for working, but they have the support of the hospital in order to practice, to assist patients, to assist medical activities in general. Of course, nurses are here, and they are as important as physician assistant. The physician assistant could be the general practitioner that is being prepared for being into the residency. Residents are the next from silent doctors. Even in this space could be. Residents, of course, do not have all the legal capabilities for taking decisions because they are studying the same as here. But silents can support their opinions for helping them to take decisions. Then general practitioners that are assistants, the physician assistant, are being prepared for getting into the residency because it's another way of being admitted into the resident. And then we have the medical students or interns that are almost in equal kind of job. In Australia, we have another way of hierarchy, just as an information for comparison. The senior medical officers are a group of, well, the chiefs could be of services and administrative professionals. And they have this way of dividing the general practitioners because they have the healthcare system, indeed, they are prepared and how they can work on the general healthcare system, and they organize the hospitals. It's another kind of degree. The staff specialties, the general ones, and the career hospital doctors, the ones that are prepared just for being the hospital, like specialists, so they can do it. It's another way of working. The visiting medical officers are the ones that evaluate the procedures, the protocols, and all of the activities. Registers are specific people that work taking data from all the patients, considering the order of the medical, of the clinical history, and that's an administrative activity. Principal house officer, well, it's the principal, the boss of these administrative activities related to the medical students just, and the resident medical officers. Of course, the principal office of all of the residences, all of the branches, and they then can work on this. Then we have the senior and junior house officer, just a division in order to organize activities, academical activities and research, and then interns. These three work equal, and that's why they are in the same bubble. And about the physician hospital hierarchy, the clinical branches, we have the attending physicians, the principal one, hospitalists, and house staff are similar to the fellow. And the fellow, well, it's indeed here. We have fellow, resident, the chief resident, the senior resident, the junior interns, and med students. So you can see that's the way it's similar to Bolivia, this organization. It's similar, but well, we know that it's not the same. Every country has these own activities and divisions and hierarchies done in order the necessities they have. Medical teams, as a definition, well, we have to consider this. A team is a group of junior doctors to help care the patients of the consultant physician and surgeon. So, for example, in this team, it's not the surgeon the only one that is going to treat the patient and evaluate the situation and control all of this. So he has full aid, full help could be for attending, for visiting, for giving the medical assistance that the patient needs, and go taking turns, not all of them together all the time. We all know this. Moreover, we have the multidisciplinary teams that are groups formed by doctors and allied medical professionals. That's the idea we have to get. The allied medical professionals are the ones that are helping us. You're going to check how. In this slide, I know there's a lot of text, but we have to take in account that in capital letters, we have some expressions, some words that are important for vocabulary, because that's the correct way of talking and giving a good idea while during an explanation or showing or explaining how we do. So that's why we said when patients enter or are admitted, it's the expression we have to take in account. When patients are admitted to hospital, they are usually sent first by one of the junior doctors on the ward, okay, where they will receive treatment and care, the first step of attending medical assistance. The junior doctor clerks them, takes their medical history and examines them. Also, the junior doctor clerks them and examines them. To clerk is to take all the medical information or to make the medical history. Sometime later, the register also sees the patient. The register, as I was telling you, is that a specific person that goes to the patient and takes all of the general data, full name, age, date of birth, health insurance number, health insurance company, job, contacts, relatives for calling, family members, well, everything that is important at the moment in order to get the correct information. That's why the register in many countries is very important, because they don't have to make a mistake taking the information. If there is any mistake, it's not possible to work on this way, could be, and take the correct health insurance and the correct capabilities of the specific health insurance. Well, the register also sees the patients and may order investigations or tests, for example, X-rays or ECG. It means the junior gives the idea while doing the clerk can examine. The junior starts making all of this, and the register, it's just the administrative activity to give a mark and send all of the papers. The register in other countries could be as a helper of the physician that just organize all the papers and send it for doing this. And well, with this sending, while checking, taking into a chart, taking notes in a chart, they can give a diagnosis considering the investigations and all of the information that the junior sends. And begin the treatment that the junior started or indicated. The consultant is the first specialist that goes to check the patient, usually sees the new admissions, the new patients that are admitted on the ward. And for the first time, first time on one of the regular ward rounds, that moments when we go in a schedule evaluating patients, it's a moment when the management of the patient is discussed with the register. The register is the one that, as I was telling you, it's organizing this information. Consultants are also decide when a patient is ready to be discharged, that can go home, is sent home, or maybe stay into the hospital for treatment. On the ward round, the consultant is accompanied by the team and the nurse. Of course, we all know that always a nurse is with us while going to the ward round. Okay, without our nurse, maybe we can lose a detail of medication, the schedule they organized, the antibiotics, for example. And they all visit all the patients in the consultant's care. Here in Bolivia, we have something similar. But for example, junior doctors could be called the general practitioner in emergency room. I tell you by experience, I take all the information, take the medical history by emergency, give my diagnosis, start all the studies and give a provisional idea on start the treatment. Then becomes the specialist, the consultant. They check all the information I sent, and we usually decide with the resident and the nurse if the patient stays in the hospital or goes home, depending on the evolution it has into the emergency room. Here it's easier to explain because in other countries they have another way of talking about. Talking about shifts, the wards. The ward is the complete full moment when you are into the hospital working with your patients that are assisted at the moment. You are the responsible of the patients, so you can take that information. The shift is one in which the schedule is rotating in hours and days previously agreed. Is the same shift of word could be called as synonyms. It depends on the place you are talking about. And also shifts, for example, in UK, is the moment when you exchange, is the moment when you go out and your partner and your colleague comes into. You are finishing the word, you get into the shift moment, you go out and your colleague gets into, it could be called a shift too. It depends on the place. In USA, shifts are these complete time. In UK, word is the complete time. Okay, so it's just a way of definition of talking that could be a little harder. So considering this, shifts are one of the most important activities we all made during the med school, during in the full career, we all know about it. So taking it in count, we can consider that we have the hours. In some countries are just 8 hours, 12 hours, it depends on the place, or maybe 4 hours depending on the branch you are working on. And here in Bolivia, we have usually 24 hours by shift. Okay, and we have a role, and following that role, we know when we get into, when we are free, we can organize our personal lives too. That's why it's important. Talking about nurses, well, first of all, in my opinion, they are our first allies, our right hand, because we give orders, we send the indications, and then they follow all the indications and make real that patient receive the medication. Without nurses, we cannot do, I think, a correct job, a correct care. I don't have personally, I'm being sincere with you and all of the people, I don't have the strength for cleaning up a patient, for changing a pamper at this discharged toilet. It's not possible to me. I cannot. If the patient is vomiting, usually the nurse goes and cleans up the patient, prepares everything, cleans up the place, and then, well, the cleaning team can come to finish the activity. But the one that is attending, that is assisting the patient, is the nurse. We just prepare. We, as doctors, we give the indications, we prepare the evolution, we give our medical notes, and that's all. Without them, it's not possible, all of the activities, I think. Going ahead, of course, they have grades. The student nurse, a nurse who is still in training, of course. The staff nurse, a nurse who has completed the training course. She can work, but she's not the chief. The charge nurse, a more experienced nurse who's in charge of responsible for a ward or department. They are almost the boss, and the nurse manager, the one that is, of course, in charge of several wards or several departments, and usually they are older. Yeah. Why we said, well, nurses, we have this modern way, and we have this. In past, when we were in war, when the nursing career started, at the beginning, volunteer women used to go there and practice these activities and practice this career. They went, they give the assistance, the medical assistance, all the activities they have. But through the time, because there was a volunteer activity without payment, the church decided to do the same and start sending nuns. Start sending this kind of this supposed kind girls for assistant patients, for giving the special attention, giving peace, reading the Holy Bible, in order to spread the message of God, could be, and also assisting patients. In many countries, nurses are still called mother or still called nun, but just by tradition. That's why it's important to take it in count. It's not for being in confidence and taking a ganja for talking to them. No, it's an historical reason. They said to the nurses mother or nun, and then the name, for example, Mother Maria, for example, unknown Maria is in charge of the surgical department, for example, or Mother Maria is in charge of the children, I don't know, children department, and that's important. On this word, Mother Maria is in charge of the shock room, for example. That's important. More we have this support workers. We have a specialization of nurse, and we have the nurse roles. When we talk about the support workers, we consider the nursing auxiliary and ward clerks. Another definition that it's not used here in Bolivia, but it's used in the UK specifically. The support workers for nurses are that ones that has done a short course and obtained the basic qualifications. They are not as, they don't have the biggest degree, could be said, but they are, well, they have the capabilities for assisting nursing staff. They are like helpers of nurses. We all know all of them. Moreover, the ward clerks, well, as I was telling you, are the ones that are taking notes of the information and are up to date and answering the telephone. So they're the ones that are in charge for taking that information. The registers could be in other countries. Here in Bolivia, we don't have the ward clerks, but we have a nurse or a nursing auxiliary that is in that kind of job. Or maybe an administrative one that for details is going to take some information, specifically for health insurance, I mean. In nurses, we have the specialization, of course. They could be a midwife, the childbear. In some countries, they have the capability to follow all the pregnancy and childbirth, go with the patient to the hospital and visit the obstetrician. That's why it's important. In some countries, for example, in Peru, they have this career. They make the nurse school and they go to the midwife branch and can work with in that way. The district nurses are for USA and, well, Europe in general. They visit patients at their homes. They can go alone because they are patients that are under control, without risk, just chronic situations that don't need specifically that doctors goes to visit them. If they see any risk, they call the doctor, wait for him, because there's a doctor for taking that responsibility, and then can work ahead. And now the health visitors, they also work on community, but giving advice on the promotion of health and prevention illness. They give lots of education. It's not the same, the district nurse and the health visitor. District nurse visit and control chronic patients, and the health visitors give education in schools, universities, healthcare centers. It's different. Well, talking about the nurse's role, of course, they have specific responsibilities that we all know, but we take in account that in other countries, they have more responsibilities. They have a bigger, a wide place of job, could be wide activities, and they can remove sutures, prescribe some drugs, order lab tests, basic ones, and they are getting more responsibility through the time because they help doctors to make the job faster, better, and of course, taking a decision with results. They also can remove cysts, take biopsy, specifically in Australia and the UK. I found information about it. In the USA, they just can remove sutures, prescribe drugs, or X-rays or MRI or CT scan if there's a very obvious situation to do it, or an ECG for not wasting time and not losing information with our patients. So it's important to take it in account. The nurse hierarchy, just an information. I sent this chart, this slide, but it's just for showing you that they, of course, they have their hierarchy, and that we have to consider this. Talking about allied medical professionals, we consider them as one of the most important part of our jobs, because there are many activities that we cannot do it alone. We cannot finish by our own. So we have the community health at the beginning, the physiotherapists, the physios, and they help people to move by getting exercises or treating their body with heat or massages, manipulating muscles and joints with the hands. So you can see the physiotherapist get exercise and recover to a normal life. For example, if you have a fracture, while taking out the cast, you have to go to the physio and complete the treatment, and that's all, in order to get as the normal activities you had before the fracture. It's not the same as the occupational therapists, the OTS. These people help people with disability to perform tasks at home or at work. They help people in order to reach a better kind of life. In some countries, the occupational therapists, the OTS, are different from the physios. In order, the objective they have to consider or the procedures they have to do. Here in Bolivia, physios and occupational therapists could be the same because of the preparation they have. Of course, in all of the countries, they have the same activities during the school, during the university, and they have this, but it depends on the branch they decide to practice and to work as the best to get the specific title. It's for another country, just as an information, and taking the idea. Then, for example, if you go for working, studying, or living to another country, you have to take into account that the physio is not going to attend the disability. Because they say, it's not my branch, I don't consider these cases, sorry, make again your referral to later. So making again a referral is wasting time for our patient, and it's not a good idea to work in that way. Well, about the definition, the disability is the physical or mental condition that makes it difficult to live normally, of course. For example, blindness or deafness. So we know it's not easy to live in that way, or having a cerebral palsy or losing extremities like this guy in the picture. So taking this definition, now the physios and the OTS have to be clear in order to talk in the module 2. Moreover, we have social workers. Sometimes because we consider that they just take information, see the social structure, and that's all, but no, they have a role that is very important in order to solve the social problems of patients. For example, housing or unemployment or family problems that are being the trigger situation for many mental diseases, for example, or they have not the power, the capability to act as a branch with the health insurance and the patient, and they can help to give or to make it bigger or to give more assistance from the health insurance to the patient conditions. That's why it's important that social workers are involved with us and consider the important activity they have. They are prepared for being in health branches, not are the same. Well, it's not the same to be in laws as a social worker than being in health, of course. And we take in account this. Now the chiropodists or podiatrists, they treat conditions affecting the feet. Of course, it's studied in every country and they need a register and that loyal documentation in order to get their work done. and they can solve lots of situations, but when they consider it's not possible to do it, they just avoid the case and refer to the patient. Traumatologist could be, in order to solve it, or dermatologist if there's a skin lesion maybe. Moreover, we have the technicians, very important ones that help us to take, for example, radiograph, the X-rays technicians. They have a specific preparation in order to take positions, views, improve the image, the picture. So we must consider them. The ambulance technicians, that they work on the emergency medicine service. They go pick up the patient and go away. And the paramedic, the ambulance technician with more advanced qualification. The paramedics are the ones in another countries that are prepared to attend or to assist the pre-hospitalian situation, trauma, shotguns, bleeding control, accidents. They are, well, with lots of advanced qualifications, different from medical school maybe. They are related, but are not the same, and they give the primary assistance. Okay, so just for taking the difference, the ambulance technicians usually just drive, used to are helping for, well, they help picking up the patient, being secure. Then the paramedic makes all of the activities, use shots, use fluids, starts medication when it's necessary, and the ambulance technicians is driving the ambulance in order to run to the hospital. Both of them have a specialized preparation, and paramedics, of course, are very interesting. We have prosthetists or orthosists. They provide care to anyone who needs an artificial limb. We all know the situations, and it's very common now to find by internet many people that is starting giving by free to patients that have not all of the resources, the artificial limbs for improving their kind of life. Okay, anyone who needs artificial limbs or prosthesis or a device to support or control a part of the body, the orthosis. For example, these splints are orthosis. They just help for moving. Glasses are orthosis in order to help to watch better, but the artificial limb is, well, the prosthesis to help us to work with the artificial limb in order to be like normal. And they also advise on rehabilitation, helping patients to return to normal life. So, you know, how they help advise, because they have the capability to prepare the material, the artificial limb, for example, according to the necessity of the patient. We all know this. Moreover, we have the opticians. They are prepared for making test eyesight and prescribe glasses. Just do that. Also known as spectacles, glasses or spectacles, and contact lenses. During the examination, they can include the intraocular pressure and the examining of the retina, just checking, not giving diagnosis, nor treating diseases or illness. They just evaluate the situation, give a referral, and send to the ophthalmologist if it's necessary. If it's just the eyesight and glasses or making the examination and there's not necessarily the ophthalmologist, well, it's well done. And as I was telling you, they usually send first to the GP, and the GP, if it's necessary, sends to the ophthalmologist. It's because the way the system healthcare is prepared. And don't forget that mastery. Whatever you practice over and over again. As I was telling you last week. This is a general view. This is a general introduction, could be for the module 2, because we are going to use lots of this vocabulary, these definitions with our currently practice, I mean, and then we have to take in count for well, our exercises. Now, in module 2, we're going to start taking more data about our medical history. We're going to start writing down more, and then we have to take these definitions for doing it well without confusing or mixing meanings. Okay, I think it's important to get clear. Is there any question about it? Something you would like to point, something you would like to ask? Nothing new. Okay. So let's fill the pool. Let me send it. It's for attendance. Don't worry, don't forget it. Please go ahead. There are 2. Okay. I'm gonna send it again. Don't worry, Denise, at the end. If there is someone else that cannot watch it, there's one classmate that it's not possible to fill it. I need 2 students more, one that I'm going to send again and one more. Well, any question about homework, maybe something you would like to point about it? I sent by message the new deadline that it's until Thursday at 5 p.m. It's important for you to check it. As I sent into the message, all the abbreviations that are going to be into the test are in the homework. So work on this, practice on this, and well, that's important. The anatomical references are going to be similar, don't worry about it. And I think that's all. The ones that fill the pool can leave the session. Thanks for your attendance. And well, there's no problem. See you tomorrow in the workshop. And during the workshop, we can solve doubts from the previous slides, or maybe these slides. There's no trouble for me. Use that time for avoiding any doubt you have in order to test and everything, because it's important, okay? So, well, the ones that didn't fill it, please stay. I have 2 students that didn't fill it, so the rest of the people can go home, can go for practicing the general idea, okay? So see you tomorrow. Bye-bye.
See you, teacher.
Teacher.
Bye, teacher. Bye, nice to see everybody. Please, Denise, stay at the end in order to fill the pool, okay?
Okay.
Okay, Denise, I'm sending it again. Can you watch this? Oh, perfect. Dennis, that's you, the one who's filling it, right?
Yes, I already sent it to you.
Okay, thank you.
Thank
so
you very
much.
much.
Dennis.
Have a good night.
No,
See you tomorrow.
You're welcome. Have a good day. Yeah, see you on the workshop. Please focus on the homework we have and questions for the next, for the test. And if you want, we can talk about it.
Okay,
We're going to talk about these slides. Okay?
Yeah.
Okay, see you tomorrow.
Have a good night.
Bye-bye. Thank you so much, you too. Have a good night. Well, everything is done. And that's all. That's all. And well, we can go home. We can leave. I don't know. I turned on my camera, but it's not appearing, but well, there's no trouble for me. So goodbye. Let me finish